You may have heard about a new law that passed back in July called the Big Beautiful Bill. But what does it actually mean for Medicare and for your coverage? The third impact, this has to do with Medicare prescription drug prices. When Congress passed the Inflation Reduction Act back in 2022, Medicare was given the power to negotiate drug prices on some of the most expensive medicines. That was supposed to start in 2026. But the new Big Beautiful Bill makes two important changes. First, it expands something called the orphan drug exemption. That means if a drug was approved to treat a rare disease, what's called an orphan condition, it now stays exempt from Medicare negotiations until it gets approved for a more common use. For example, drugs like Darzalex, used for multiple myeloma, or Opdivo, or Yervoy, used in certain cancers, are now shielded from negotiation entirely. In plain English, these companies can keep charging higher prices for longer. Second, the bill resets negotiation timeline for some blockbuster drugs. Take Keytruda, one of the top-selling cancer drugs. It was scheduled for negotiation in 2026. Now that date gets pushed back to 2027, and that one-year delay means billions more in cost for Medicare and potentially higher out-of-pocket costs for folks on Medicare. So the bottom line, while the negotiation program is still alive, the Big Beautiful Bill pokes big holes in it. Some expensive drugs are now off the table completely, and others won't be negotiated until later, which means those savings are delayed.